Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a super degenerative disc disease exercise to share with you. It's the standing bird dog emphasizing spinal stability. Hope you enjoy. So what I like about the standing bird dog exercise is it's great for patients with degenerative disc disease problems of their back, mid-back, or neck because it challenges all three planes of motion in the body at once. You know, we have three planes of motion, meaning forward to backward stability to test our spines, lateral stability or side shifting translation, as well as rotational stability. And if you're like a lot of my patients that I treat with degenerative disc disease, one of the things you're going to find is that it's great to have an exercise that incorporates three different exercises into one. It helps you save time, and it's more likely to be consistent in your weekly routine. The more consistent you are with strengthening or rehabilitative exercise of the spine, the more pain relief and lasting pain you'll have with doing them. So let's begin by making sure that we're going to make this specific for your body. One of the things I'm always stressing with patients and clients is that any exercise that's done in a general way, unless you're tailoring it to your specific needs, usually only strengthens dysfunction, meaning that it perpetuates your abnormal posture and body mechanics, which in turn stresses your degenerative discs and leads to more trouble. So what we want to do is when we do the standing bird dog exercise, we want to make sure we're correcting any postural faults we have. If we have a tendency to lean to one side or have one hip come up on one side typically, or if we have a tendency to rotate to one side, you'll know this if you just look at your posture in the mirror. You'll see if there's any type of dysfunctions or abnormality, asymmetries from one side to the next. You want to correct those. So you're always keeping the bottom of your rib cage level and the top of your hips level. You want to make sure that if you have an anterior pelvic posture where you have an increased curve in your lower back, meaning your tailbone is higher than your pubic bone, you want to correct that by keeping your tailbone tucked under a little bit. Conversely, if you have a flat back syndrome where your pubic bone is higher than your tailbone and your curve in your lower back is actually too flat, then you want to do the opposite and correct that. You want to raise the tailbone a little bit. Again, all these corrections you want to make sure you're doing in a pain-free range of motion. You want to make sure that when you're doing this exercise, you're using your core muscles to hold that good alignment. You know, that's the whole idea of core muscle workouts. People misunderstand. They think they work core muscles to just do planks and bird dogs without thinking, what are the corrections in my unique body? If you're just doing that, you're strengthening the dysfunction. You're strengthening the muscular forces then that are abnormally stressing your spine. So let's make that specific. Again, get your alignment set. If you're not sure about your alignment, you can always go to the Pain Free and Fit or PostureSize.com websites. We have a free body analysis there. You can check out what your posture and unique mechanical issues are. So, without further ado, we're going to use this in our bird dog. We're going to pull our alignment in, okay, whatever corrections we need to make. Let's say my alignment is I have a tendency to lean left. I want to make sure I'm leaning a little to the right to be straight. I'm going to hold my lower abdomen, that's the transverse abdominis, pulling it in towards my spine, and that's going to create a little bulging out on the side of those vertebrae. I might put my thumbs right on the bottom tips of those vertebral bones in the center of my back. When I pull my lower tummy in, I should be able to feel a little bulging out. Those are the multifidi muscles that are contracting and helping to hold your spine in a nice, neutral, good posture aligned position. Once we have that and the correct amount of tilt up and down with the tail or twist side to side so we're locked, we're going to raise one leg back as we squeeze the buttock without overarching the back. We want to keep the tail under as we do that, and we want to avoid external rotation with the leg. We want to keep the foot so that it's straight, not turned out. And we're going to raise the opposite arm up, okay, without hunching the shoulder blade up into the neck. If you have degenerative disc condition of the neck, in this position you want to make sure you're not goosing your head forward, but keeping the face back. So we have an alignment between the ear, shoulder, and hip as we hold that position. Now this is a balance exercise, so you may want to tap onto something for a little bit of balance as you're holding the position. On the standing leg, you want to make sure you're pushing that hip down and raising the rib up. So that keeps the hips and the ribs level. Again, remember, we're doing this so we're maintaining all of our alignment and posture corrections. That keeps our spine in a neutral, safe position and is training the core correctly. The tendency on this side, when we're standing, is to have the hip swing up. That's hip hiking. Very dangerous. So you want to keep that hip down. You'll feel a burn going on in this hip and this butt as well as this buttock. And as you maintain that position, you count for anywhere from 10 seconds. Eventually you want to work up to about 2 or 3 minutes in that position and then switch legs. So that's the standing bird dog. We want to make sure as we're holding that position, we're not twisting to one side. Typically what happens is the pelvis wants to turn away from that standing leg. We want to make sure the pelvis is turned in. We're holding all that alignment. It's challenging us from tilting back and forward. It's challenging us from hip hiking and rib leaning on that standing side. So it's a sideways challenge and it's a twisting challenge. So you're getting all 3 planes in one as you're holding that position. Again, if you want any more core exercises, please feel free to subscribe to our channel. We've got lots of them for the back, degenerative disc conditions, and other back problems. Leave us a line in terms of if you have any questions. I'll do my best to answer them, or if you have any suggestions for further videos, I'll do my best to include those in future videos. Hope you enjoyed the standing bird dog. To better health in your spine.